Hey, I'm Chandler Lassiter, and today we're going to talk about the banning of the phrase evidence-based and its effects on the leisure services industry. In December of 2017, the CDC banned 7 words from being used in their reports to the White House. This ban has made the CDC adapt to the wording used in their reports. They now have to be more aware of the language they're using when they're writing these reports. These 7 banned words include vulnerable, entitlement, diversity, transgender, fetus, evidence-based, and science-based. Today, we're going to take a deeper look into the phrase evidence-based. We will discuss the background of the CDC and of this phrase, the effect of these bans on the Parks and Rec field as well as all industries, how to replace evidence-based with other phrases, and what evidence-based really is.
Hello, my name is Danny Johari, and I'll be covering the background and the term evidence-based. The CDC, or Centers for Disease Control and Prevention, was formed in 1946 under the Truman administration. It is a federal agency and is a part of the Department of Human and Health Services. The CDC's main goal is to protect America from health, safety, and security threats, whether foreign or domestic. The term evidence-based was the most used term in reports done by the CDC to the White House for budget reasons. According to the National Institutes of Health, evidence-based medicine is described as thorough, explicit, judicious, and reasonable use of modern, best evidence in making decisions about the care of individual patients.
My name is Ty Lovett. I'm going to be talking about the different effects this can have on the field of leisure services. So some of these effects we could see on the CDC as well as leisure service providers include the inability to make clear and concise points in reports to the White House. These reports will also likely get much longer. An example of this would be if the CDC had evidence to support a flu outbreak, and instead of saying this recommendation is evidence-based, having to say we make this recommendation based on different evidence we have gathered. There's no real value in this, and it only lengthens reports. This begins to affect the leisure service field when dealing with different people who are suffering from diseases that would have had more research from government funding had the change not been made initially.
I'm Trevor Edwards, and I'm going to be talking about how the CDC uses evidence-based in their reports. An evidence-based approach to disease prevention can reduce the burden of chronic diseases such as cancer, diabetes, and asthma, among many others. Evidence-based decision-making is based upon the best available scientific data. So scientists at the CDC make their decisions on how to vaccinate and treat diseases based upon the evidence they deem to be the most trustworthy. Evidence-based policies are those that are written with reliable data sources in mind, and CDC officials test the data before they release medications or vaccinations. CDC Director Brenda Fitzgerald has stated to the public that evidence is and will remain to be the foundation of our work. So while they may not be able to use the phrase evidence-based in their reports, they will continue to use evidence to make important decisions. The CDC conducts studies on how to increase the use of evidence-based decision-making in situations such as sexual education, which uses evidence to reduce teen pregnancies and STDs.
My name is Kayla Jones, and I will be talking about recommendations. The White House recommended that they use phrases such as, with our research based on evidence. And as a group, we also stated how they can use phrases such as, we make this recommendation based on different evidence we've gathered. The CDC has stated there are no banned words at CDC, meaning they will use words as they see fit. The CDC could meet with the White House official and attempt to explain why terms like evidence-based are vital to the agencies and reports.